Welcome to Elna's Yoga 360. Today's video is a 20 to 25 minute asana practice which helps relieve the constipation. This video is part of a 30-day program that I have for relieving constipation, especially for people who have chronic constipation. So if you'd like to know more about the program, I'll put the information and the contact numbers in the description of this video. Now, if you're ready, let's get on your mat and very gently lie down on your back. Just keep your legs bent and keep your feet wider than your hips and let the knees to rest on each other. Close your eyes. At the beginning of the class, we always want to bring the attention to here and now. Start to deepen your breathing. Relax your shoulders on the floor. And just remember that you carved out this time for yourself. You deserve attention and you deserve being calm and relaxation. Continue with your breathing. Just relax your shoulders on the floor. Relax your jaws. Relax the bases of your neck. Now let's do a couple of deep breathing. Lengthen your inhale and lengthen your exhale. Inhale through your nose. Exhale through your mouth. Let's do this 2 more times. Inhale through your nose and exhale through your mouth. Imagine with your inhale, you're getting all the vital energy and prana into your body. With your exhale, you're exhaling all fatigue, negative energy, any negative feelings out of your system. Let's do this 1 more time. Inhale, positivity. Exhale, anything negative out of your system. Now when you're ready, gently open your eyes. Let's hug your knees into your chest. You're starting with Uppan Asana. It's a wind relieving pose. If you want to sway yourself a little bit to the right and left, feel free. You're pressing your upper thighs and knees into your abdomen. Now let's take a deep inhale here. With your exhale, lift your chest, bring your nose to your knees and let it go. Let's come back again. Inhale on the floor. Exhale, bring the nose to the knees. You're squeezing the body. Again, inhale and exhale. Now gently lie down. Let's straighten your left leg and keep your right knee into your chest. Inhale here. With your exhale, bring the nose to the knee. Again, lie down. 1 more time. Inhale here. With your exhale, bring the nose to the knee. And let's switch. Flex your right foot. Actually, flex both foot. So inhale here. With your exhale, bring the nose to the knee. Let's do this 1 more time. Inhale on the floor. Exhale, bring the nose to the knee. And gently come back down. Again, bend your knees and put the feet on the floor. Keep your feet parallel to each other, hip width distance. We are practicing a little bit of something we call Kegel movement, Kegel exercise. It's a pelvic floor exercise that we practice also in yoga. It's definitely an important part, an important organ. The whole pelvic floor is an important organ for people who suffer from constipation, and it's through these exercises we are basically learning how to manage and move these muscles. So the way that I can explain it to you is that while you're here, just try to squeeze the pelvic floor muscles and lift them up. So if you want to know what are those muscles are the ones when you want to, you're going to pee. Basically, if you want to, obstruct your peeing, you basically squeeze those muscles. So those are the same muscles. So gently start to squeeze those muscles, at the same time lift them up toward your abdomen. So what I'm going to do is that now first we're going to inhale. With your exhale, you're going to squeeze them and lift them up to your abdomen. So again, release your breathing. Again, inhale, normal. With your exhale, you're going to squeeze them and lift them up to your abdomen. We're going to do this 5 more times. Inhale. With your exhale, squeeze those muscles, lift them up toward your abdomen. So it's a very internal movement. You don't see those muscles from externally, so those are completely inside. From your perineum, you can actually squeeze them all the way and bring them more toward the abdomen. Let's do this 2 more times. Inhale. With your exhale, squeeze them and bring them to your abdomen, toward your abdomen. Last time. Inhale. With your exhale, again, just engage those muscles, squeeze them and bring them all the way to your abdomen. And now release, let it go. So gradually, as we move through this 30-day program, we are going to increase the number of times that we are using these Kegel exercises, or basically pelvic floor exercises. Now the next step is that you're bringing your knees into your chest, stack them next to each other, gently lower them all the way to the right side as you're extending your left arm to the left side of the room. You can either open your right arm or place your right palm on your left quadricep or left thigh. So this is a reclining twist. It's definitely a great twist, especially for digestion. Anytime that you feel you have trouble with your digestion, or if you feel you had a big meal, you can just lie down, do these twists. And overall, twists have this detoxifying effect on the internal organs. So it's a great practice for anyone who has constipation to incorporate more twists into their practice, into their yoga practice. Again, breathe in and breathe out. You're keeping both sides of the shoulders on the floor. You can gaze either toward the ceiling or to the right, anywhere that you feel more comfortable. Now gently come back to the center and then bring your knees all the way to the left side as you're extending your right arm to the right side of the room. Your palm is facing toward the floor. And again, breathe in and breathe out. Just feel the stretch that is happening around the intercostal muscles all the way to the inner organs. Staying here for 2 more deep breaths. And then gently come back to the center. Let's rock yourself to the front and back for a couple of rounds, giving a little bit of massage to your spine before we come to the seated position. And then when you get to the seated position, let's do one more twist, more seated twist. Extend your left leg to the front. Hug your right knee into your chest. You're keeping your right foot on the floor. And then either you can hug your right knee with your left elbow, which is recommended, and place your right hand behind yourself. Or if you feel you can twist further, you can actually hook the outside of your left elbow on the outside of your right quadricep. And basically from here onwards, you're using the levers of your right hand on the floor, pushing to the floor and twisting further. I myself recommend hugging your right knee into your chest and twisting further. So flex your left foot on the floor, keep your chin parallel to the floor, and you're trying to avoid rounding your back using your right hand on the floor. Elongate your sternum toward the crown of the head. Inhale, and with your exhale, just twist a little bit further if possible. Breathe in and breathe out. This is called Marichyasana Twist, and it's one of the great twists for digestion. You know, as we are using the thigh muscle into our abdomen, so we're pressing these two together and at the same time twisting. Now let's switch. So again, extend your right leg, bend your left knee, and again you're going to hug your left knee with your right elbow and place your left hand behind yourself, and again press to the floor as you're straightening your back, lifting your chest, elongating through the crown of the head and twisting further. Breathe in and breathe out. Staying, at least 30 seconds to 1 minute on each side would be beneficial. And again, just remember that constipation has usually, in most of the chronic cases, has been around for a long time. And, it's a great thing to set the expectations based on reality and knowing that these poses are going to help if you actually practice them on a regular basis. And gently come back to the center. And then from here, let's come to the seated transition to your tabletop. So coming to all fours, your wrists are underneath your shoulders, your knees are underneath your hips. And when you're ready, start with few cat-cows. So open your heart forward, and you're arching your back, and then exhale, you're going to round your back all the way from the tailbone to the crown of the head. Inhale again, open your heart, collarbones wide, pull the lower belly in, exhale, rounding your back. Let's do this 3 more times. Inhale, open your heart, exhale, rounding, bring the chin to the chest. Inhale again. This is called cow. And exhale, going to your cat. Last time, inhale. And exhale. Great. And then from here, place your left foot between your hands. If you need to pad your back knee, please put something underneath your back knee. And then very gently, you're going to come to your low lunge. Place your hands on your left knee, left thigh. So if you're ready and feel you're stable, then you can reach both arms toward the ceiling. Stay here. Just feel the stretch that is happening around the abdomen. You're elongating the body from the sides of the body. Breathe in and breathe out. So externally rotate the outer arms. You're firming the outer arms in. Now when you're ready, with your left hand, you're going to grab the right wrist and gently twist, basically gently lean to the left side as you're stretching the right side of the body. Breathe in and breathe out. And gently come back to the center. Now bring your hands to your heart. You're going to do another twist. Lean forward, and when you're ready, you're going to twist to the left and place your right tricep on the outside of your left quadricep. And then from here onwards, you're using the levers of your hand to basically twist further. Again, elongating your sternum to the crown and twisting to the left. I would recommend to stay here because we don't want to necessarily exert a lot of energy here. However, you have the option of curling your back toes and lifting your back knee off the ground and basically deepening the pose a little bit more. Breathe in and breathe out. Again, maybe 20 to 30 seconds at most. This is also one of the effective twists for the digestion. And then gently put your back knee down, come back to the center, push back to your tabletop. And when you're ready, you're going to place your right foot between your hands and come all the way to your low lunge. Reach both arms up. Breathe in and breathe out. Just give that external rotation to the arms. You're pulling the lower belly in. The inner thigh of the front leg is spinning toward the floor. You're lengthening your tailbone toward the floor. Breathe in and breathe out. Now with your right hand, grab the left wrist and lean to the right, giving one side body stretch, lateral stretch. Come back to the center. Bring your hands to your heart and gently lean forward. Again, you're twisting to the left. Place your left tricep on the outside of your right quadricep. And then from here onward, you're pressing and using the levers of your hands and twisting to the right. Breathe in and breathe out. So not only the intercostal muscles and the corset muscles are involved, but when you do this pose, you're also again squeezing all the inner organs, the intestines, small, big, stomach, all of those are getting partially squeezed in a good way. And that's why the twists are detoxifying. They're known to be detoxifying, especially if during this program, the 30-day program, we use a couple of dietary techniques, which are, some of them are cleansing, some of them are helping with constipation relief. The effect of asana practice would be definitely much more. And again, coming back to the center, place your hands on the floor and then push back to your tabletop. And then from here, very gently, you can walk your knees a little bit toward the back or even walk your hands more forward and come all the way down to your bellies on your mat. So we're going to practice a couple of back bends. So place your arms alongside of your hips. Pull the lower belly in. So basically you're lifting the pubic bone to your navel. Engage your leg muscles. The inner thighs are spinning toward the ceiling. When you're ready, lift your chest up. Lift your arms and lift your legs. So you are on your belly muscles. This is a variation of Shalabhasana. Breathe in and breathe out. And gently lower yourself down. Let's do a different variation. Open your arms to the sides. Again, inhale, you lift your chest, lift your arms, and lift your legs. Breathe in and breathe out. Gently lower yourself down. Now extend your arms all the way to the front. This version is a classic version of Shalabhasana. When you're ready, lift your arms, lift your chest, and lift your legs. Breathe in and breathe out. So you're elongating the body from the sides of the body, and just be aware of your breathing. And gently lower yourself down. We're going to do this one more time. Inhale, lift your arms, lift your chest, and lift your legs. breathe into 5 seconds. Inhale and exhale to 5 seconds. Gently lower yourself down. Place your hands next to your rib cage. And your elbows are hugging your torso. We're going to Bhujangasana Cobra pose, another back bend, heart opening pose. Press to your hands. Lift your chest only. You're pressing the top of the feet to the floor. Exhale, lower yourself down. Let's do this 2 more times, dynamically. Inhale, going up. Bhujangasana. Exhale, lower yourself down. And last time, inhale, going up. And exhale, lower yourself down. And then from here, let's transition again to your tabletop. Push to the hands and your knees, coming to your tabletop. And let's go to downward facing dog. We want to transition all the way going to the standing pose. So gently push back to your down dog. So you're pushing the upper thighs to the back of the room, elongating the torso. Breathe in and breathe out. And when you're ready, walk your feet toward your hands. When you get to your hands, lift your chest halfway, Ardha Uttanasana. Inhale here. Exhale back to your Uttanasana. And then root down through the feet. Come all the way toward the standing. Reach both arms toward the sky. Inhale here. With your exhale, bring your hands to your heart. Now for a moment, I want you to open your feet a little bit wider than your hips. And your toes are gently like opening up to the right and left. Not too much. Just imagine like 1 o'clock and 11 o'clock. And then when you're ready, we want to come to yogi squat. Very gently, you're coming to the seated position. If for any reason this was hard for you, you can definitely put 2 blocks underneath your sit bones. Otherwise, just gently come to your yogi squat. And then from here onward, you're opening your heart forward by pressing your triceps to your knees, to the inner side of your knees, as you're pressing also your knees to your tricep. So this is a great pose because not only it's affecting, also it's squeezing the inner organs, and it's definitely effective in the healthy pressure that it puts on colon. But at the same time, the action of pressing the tricep to the knees and the knees to the triceps is also engaging the pelvic floor muscles, which is another target area for our practice. So stay here, breathe in and breathe out. My recommendation is at least staying here for 2 minutes, but if for any reason you get tired, you can retire yourself off of it earlier. And something that you might even know or not, but in so many, traditionally before the new toilets actually come out, like people actually used to sit like this when they were going for basically, pooping or anything, just letting go. So that was the way that originally human being was sitting or like using the posture. So right now, even that's another way to kind of like stimulate and activate the nervous system in that area. So stay here for a few more deep breaths. And then very gently, when you're ready, just place your hands behind yourself and let's come and sit on your mat. So our practice is almost done. Now we're finishing the class with a 2 to 3 minute Shavasana. So lie down on your back, and I would recommend, if you like, to use a bolster underneath your thighs or legs, so to elevate the legs. And if you want to cover your eyes with a piece of cloth or anything to kind of dim the light, it's definitely recommended. Shavasana is as important as active poses, and we are kind of tapping into our parasympathetic nervous system. So it's important to be able to let go and kind of have a moment of surrender. So again, you're not going to stay here long. However, get back to your breathing. Just pay your attention to your breathing. Let's take a deep inhale. Open your mouth, let it go. And just relax every muscle, every cell in your body. Let go of any tension, any stress in your thoughts, emotions, in your physical body. Our bodies hold onto negative energies, and even if we have been doing this and we were not aware, we can also consciously let go and surrender and let go of those, thoughts, emotions, even past traumas that they're not serving us anymore. Stay in silent, and I will call you back. You can actually stay longer in your Shavasana as much as you want. However, for the sake of this video, I will close the session. So feel free to just stay in your Shavasana if you want. And again, feel free to check the information that I have there. There are other techniques used in my 30-day program. There are like meditations, which is we're going to alternate between the asana practice and meditation, and also some dietary instructions which would help, again, relieving constipation. So if you have any questions or comment, I would be happy to see them and to respond. And thanks for joining. Namaste.